Which profession inspired heart surgery, anesthesia breakthroughs, and behavioral therapy? Well, it's not human medicine. Today on the Health Exchange, we're uncovering the deep connection between animal medicine and human health. I'm Dr. Jay Rutland, and joining me today is veterinarian Dr. Sydney Pokard. We're discussing veterinary medicine and what we're still learning from the natural world. Dr. Pokard, do you mind if I call you Sydney?
Not at all.
Okay, cool. I'm Jamie. What led you to your career as a veterinarian, especially as a father to a little girl that keeps telling me she wants to be a vet?
I decided when I was 4 years old that I wanted to be a vet after getting a little kid doctor's kit and bandaging up my stuffed animals. But once I got into high school and that passion really still stuck with me, I decided, well, let me get my first job in an animal hospital and see if I really like it. And I loved it, and I knew that's what I wanted to do.
Is there a particular patient, animal or human story that shapes the way that you practice or that really puts you in your practice today? You're like, oh man, I remember this like yesterday.
I think a little bit of every patient that I've seen has really shaped me, but one thing I can truly say has transformed the way I practice medicine is when I had to put my own pets down for the first time. I didn't personally do it. I had another vet do it for me, but just getting to experience that and being on like the client side has definitely transformed the way that I interact with my clients now. And I'm able to have this deeper connection with them that even though I knew before, I knew how sad it was, I knew how emotional it was, but it's different when you go through it yourself.
Putting your dog down or your pet down, that's one of the hardest things I've ever done. Like
100%.
it was my 40th birthday year, so 4 years ago. And our dog had loose stool all over the house. And we had this impromptu party, and this random guy was playing fetch with my dog, throwing like one of those big tennis balls, and she just kept eating off the fur. Took her to the vet, that one, the Foothill Ranch one. And she says, she's obstructed. She needs a surgery.
Yeah.
She was 12.
Yeah.
And I was like, all right, I need you to give this to me straight. I'm a pulmonary critical care doctor, right? I talk to family members and tell them that their family members dying, actively dying. And I had this discussion like every single day of my life. I was like, I need you to give it to me straight. Like, tell me what's up, right? And she looked at me dead in my eye and she was like, well, Dr. Rutland, these dogs live 12 to 14 years. And it was a blue heeler. And she's 12. Surgery can be anywhere from $8,000 to $20,000 if she needs it. And she's got to recover from it.
Yeah.
I'd probably put her down. And I was like, because that was like our first kid.
Yeah,
right? I mean,
100%.
this is who we brought home when I was in medical school. And this is, 12 years, 13 years later or whatever. Anyway, that was like, and then we put her down, and I like watched Marley and Me like every day
My
for
gosh,
like a
I know.
week.
Heartbreak.
Oh my God, right?
Yeah.
Like,
Yeah.
oh my gosh. And like one of the things that's profound in that movie was when he said, a dog doesn't care if you're smart or dumb, clever or dull. Like you give them your heart and they'll give you theirs.
Yeah.
When it comes to practicing, like what's your personal philosophy when it comes to caring for basically patients that can't really speak for themselves?
Always leading with compassion. I try to practice that in every patient I see, no matter if it's a hamster, a dog, a cat, a goat. I treat them like as if they're my own pets. And I know that can get hard when, that emotional aspect of it. But I do truly feel like treating each animal as if they were your own, trying to make the best decisions for them, advocate for them since they can't speak for themselves is really how I try to practice.
I mean, for me, it just requires like a special sense, like, right? I think of Dr. Dolittle who could hear the animals.
Totally.
When I go to the vet or if I take the dog to the vet, like there's just something about a veterinarian. They just have this way of dealing with animals. And one of my attendings where I rotated in Des Moines, Iowa for like a few weeks, he actually was a veterinarian first.
No way.
And then went into medicine.
Amazing.
And became a physician as well. And he still took care of horses and livestock and whatever. And he was one of the most compassionate, great communicators I had ever been around. Dr. Yost was his name. I think he's still alive, but he was absolutely amazing. And I mean, do you feel like when a dog or an animal comes in, like you can, I mean, I don't want to say the word talk to it, but you can like kind of feel like what's wrong?
Yeah, you connect with them when you have just the passion to work with animals, and sometimes it's just a natural kind of almost like sixth sense just to be able to connect with them in a particular way because you really know their body language and even just spending the first few minutes really connecting with the patient and the pet parent is really important and makes a huge difference.
So when you were doing this, and like say when you were a kid, I mean, was there
Yeah.
ever anyone that was like that just kind of stopped you and said, "Wait, how did you do that? How did you know?" You have a story like that?
Yeah, I definitely remember stories from when I was a kid. I don't know if I remember like a really specific one, but I definitely remember a lot of my parents' friends just being like, Sydney just has a different way with the animals. She just knows how to like naturally just take care of them and connect with them and they like gravitate towards her. I think that's more of the thing is that and even now, sometimes when I'm out, I feel like some animals will come up to me, they just somehow know I'm a vet. I don't know. They're not afraid of me.
Right.
They're always, like, coming up, sniffing me, like I'm the first person they gravitate towards.
So I have a really aggressive dog, right?
Mhm,
One of my dogs is like really aggressive.
mhm.
If she knows you, she's totally cool, right?
Yeah,
No big deal.
yeah,
But if she doesn't know you,
mm,
she's like, "Why the fuck are you here?
yeah,
What are you doing?"
yeah.
So are there ever any stories where the owner's been like, "Hey, like my dog's like really like this, like really aggressive," and then you've walked in and the dog's been totally cool with you? Like, is there and the patient parent's like, "Oh my God."
Yeah, a few times actually, especially in my current practice, that is an open concept where people get to stay with their pets. That environment definitely transforms how the dog feels. They're able to be with their pet parent, their owner, and they feel more comfortable. We also have things like couches and things just to make them feel more at home. And I use a lot of treats, maybe as a little bit of a bribe, but I've definitely had a lot of dogs that, yeah, are a little bit more aggressive, maybe a little bit more protective of their owners. But the second I am giving them treats, I'm really interacting with them, focusing on not really staring at them or using that like straight eye contact, but you want to just be kind of a calming presence around them. It definitely does make a difference. And they've been more calm and just not aggressive right off the bat or anything like that.
Medicine, human medicine has
Mhm.
evolved like rapidly in my mind over the last 15, 20 years. I mean, since I've been around it. Has veterinary medicine done the same thing? Is there anything you can think of? You're like, man, I can't believe that we're here.
100%. I mean, you asked me earlier if I had kids, and I said, no, I have fur kids. And that's the biggest thing, honestly. Like, people's pets are their children now. They're not just like a farm dog or cat or anything like that, that maybe gets care when they're sick. Like, people are taking their pets regularly to the vet. They're getting the same kind of care that they would give their human children. And so it's definitely evolved in that way. I see some patients all the time for routine care, for little things here and there. And it's definitely evolved a lot over the last several years even.
And you're talking about from a parent perspective in terms of
Mhm.
the compassion and love they have towards their animal or their
Mhm.
child.
Mhm.
What about from a medicine perspective in terms of developing and how to treat pets when they have conditions?
Yeah, 100%. So we used to just say, "Oh, well, we can only do this. Let's try, XYZ. There's only so much we can do." I mean, there's so much more advanced stuff now that people not only are willing to do, but also that we have. For example, I have done an MRI on a hamster to then do a kidney surgery on
Hold on,
people.
wait a second. Wait, no, hold on. Wait, back up. Back up. Hamsters are like $5. But I mean, and again, for you hamster lovers out there, like I get it, like I know, but it's my hamster, like I get it, but it's like literally 3.99, 2.99, like whatever. My daughter has a hamster, and wait a second. The reason I stopped and I was like,
Mhm.
you did a kidney surgery
I did.
on a hamster?
I did.
Okay, hold on. What was the issue? What was the problem? And why the surgery? Like, no, I want to know. Like, I want to know.
Had a tumor and it needed to be removed. So I removed the kidney. And so we're doing advanced things like that on all kinds of species now.
You did a micro tumor resection,
I
a
did.
nephrectomy
A nephrectomy.
on a hamster.
I did.
What's the lifespan of a hamster?
2 years. 2 to 3 years.
And how long had that hamster been living at that time?
2 years.
And you did this, and the owner was like, I want it done.
Yeah.
No, this is amazing. No,
I know.
mean,
Yes, because the alternative was to put that hamster down. And so at least we were trying something.
and how long ago did you do this surgery?
This was several years ago.
Is the hamster still alive?
No, unfortunately not.
Did the hamster make it in his post-op recovery?
Yep. She made it, and she did well for a bit longer.
When you're doing that kind of surgery,
Mm-hmm.
are you intubating a hamster?
Yeah. We have little, teeny tiny little 1 millimeter endotracheal tubes,
Shut up.
little tiny scopes. So yeah, there's a whole range of little tiny ET tubes for them.
Are you doing it under a microscope? Surgery?
I did not at that time. However, I have in rats under a microscope.
So in a bigger animal,
Mm-hmm.
you've done it under a microscope, but in the small hamster, you just eyeballed it. You're
Well,
like, fuck it, I got
yeah.
it. Like,
I didn't have the ability to do it under a microscope at the time, so I was just like, yeah, I got it. I mean, my eyes were still young at that point.
my eyes were young. Do you guys operate a lot on hamsters in vet school? Like, I can't imagine.
No, yeah. When you work with exotic animals, you definitely have to do a lot of postgraduate training or go into a residency. I did not do that route. I did a lot of postgraduate training, had really great mentorship, was able to work with a lot of different animals, a lot of different species, and did a lot of surgery. And so now I'm in the process of kind of a non-traditional route of board certification with exotic mammals. There are some residency programs and everything that you absolutely can learn to do a lot of those things as well.
I mean, some of the early experimentation on animals,
Mhm.
right? Insulin discovery, open heart techniques, things like that, cardiac surgery models in pigs. Are those things that you read about where you're like, huh, yeah, that makes sense. I understand why we would do that here before we kind of transition to humans.
Yeah, I do get it. I think it's almost one of those necessary evils. Like, I don't want to call it evil, but there's a lot of different advancements now, a lot of models or animal models to where we don't have to use a live patient at our own benefit or the sacrifice of them. But I do understand.
What animal that you know of has the longest lifespan?
Probably a lot of tortoise species, like
How can they live?
Galapagos. Some of them can live 200 years.
Whoa.
Yeah.
What is it about that animal that allows it to continue in this stage?
Their metabolism is much slower. So that's one thing that does contribute, is something that happens in a mammal really fast may take 3 weeks in a tortoise. And so that is one of the contributing factors.
Do they get pregnant, or are they eggs? Or they get pregnant?
They lay eggs.
They lay
They lay eggs. They don't do live births, but they lay eggs.
And
Yeah.
how long does it take for those eggs to develop and become a little baby tortoise?
It depends on the type of tortoise, actually.
Yeah.
So every tortoise will be a little bit different. There's some smaller tortoises that may lay eggs and it takes like 8 months to incubate those eggs and then they'll hatch. Some are a lot shorter than that. So honestly, it really depends on each individual tortoise species.
Yeah. When you are thinking about the use of animals in medicine,
Mhm.
you're cool with it. You're like, this is something necessary that we have to do to be able to develop as a society. Like, it doesn't bother you.
Yes and no. Like, I think that I understand why we used to only do that or have to sacrifice animals. I think now, though, a lot has changed, especially in vet school. So, for example, when I went to vet school, we had a reverence for life model where we did not do any unnecessary procedure on an animal just for our own learning. We only did things on cadavers, or we did spay and neuter and do routine necessary surgeries on like shelter animals, for example. But maybe 10 years prior to me going to vet school, there used to be animals, dogs that would be brought into the school for the purpose of doing any and every surgery possible so that the students could learn. And then at the end of their years of learning, the animal would be put down. So I don't really agree with that anymore. I think there's plenty of ways that we can learn how to do these things and not have to sacrifice an animal for it. On the flip side, when it comes to advancements for people, I, again, do understand why sometimes like live tissue, obviously, or being able to replicate a certain surgery or maybe a transplant or something in a live model is going to be way different than, you know, something 3D printed or whatnot, right? But so I do understand it for that. And I think I think it's reasonable to still utilize animals in that way. But I think we have now also found a way better method to treat these animals in vet school instead of just using them for terminal surgery.
Now, you were telling me about your vet school experience,
Yeah.
and you told me that for, I guess, a couple of years, you got to kind of go around the world
Yeah.
and learn.
Hmm.
One of the places you visited was South Africa.
Yep.
What was that like?
Amazing. I have always wanted to go there. And so I knew I was going to make sure to have that as one of my rotations. But I spent 5 weeks at the Johannesburg Zoo and surrounding wildlife sanctuaries, essentially, and worked on so many different like native animals
Like,
as like lions.
hold on, you work on a lion?
I did.
You operate on a lion?
I didn't at the time. Can I tell you though, a little segue? My very first case as a vet ever was a lion in status epilepticus that I had to give 3 bottles of diazepam to get it to stop having seizures. That was my first case literally ever as a vet.
Wait,
An
okay.
African lion.
An African lion. So you guys, like, status epilepticus is where your brain nerves just keep firing and you just continue to seize, and you have seizure after seizure after seizure after seizure, and you have to give medicine to calm down the nerve and basically tell the nerve to STFU. You just need the nerve to like just really calm down. Your first case as a vet. So you finish school.
Yeah.
You're done. You're like, yes, I'm done with school.
Yeah.
You take a job.
Yeah.
And I'm assuming you worked for somebody. Did you work for the
I did.
zoo or something?
A zoo and a small animal and exotics practice.
This lion was at the zoo?
It technically was at a private facility.
It was somebody's pet?
Not exactly. It was a lion that was used in like the entertainment industry, but it was at a separate facility in the back of someone's house.
So somebody's got a lion in the back of their house chilling.
Yeah.
For entertainment purposes.
Yeah.
So that lion had a bunch of seizures.
Yes.
And they're
They
like,
called a
Dr. Pokard, I need you to go. What was
They-
that feeling
they-
like?
fear initially, for sure. My boss was like, "Hey, I need you to go do this. Can you do this?" And I'll like, "You can call me if you need help." I was like, "Me? Are you sure?" He's like, "Yeah, you just graduated. Like, you're good. You can do this." I was like, "Are you sure?" So, yeah, a little bit of fear. And I was by myself. I did not have
You
a
didn't have any
nurse with
staff?
me or
Nothing?
anything. No, I was by myself. Placed an IV catheter by myself
Take me to that, like the scene. Like you walk through this house.
in the backyard. Well, the backyard was essentially like it looked like a zoo, like different cages. They had other animals. And there was the lion in one small cage, maybe the size of this space that we're in right now. And the handler had it on like a leash, essentially, like a chain. And I just worked in the back end on concrete almost at nighttime. It was probably almost like 8 o'clock at night.
You found
And yeah, kept seizing. So gave it some more, gave it some more. And then finally finished. Didn't have any more seizures, ran some IV fluids, and left after I was there for about 5 hours.
You didn't
so.
say like, hey, the lion probably needs a head CT.
Yeah. So then we actually transported it shortly after for an MRI down to Orange County.
It sounds like the industry, at least veterinary medicine, has changed in terms of how they're dealing with animals and how we're using animals to educate. What was the most exciting case that you came across?
I think one of the most exciting cases was probably a zebra. I mean, we weren't really doing anything like major in terms of it wasn't like a crazy fractured limb or major abdominal surgery or anything like that. But essentially, like all that it takes to have an animal be hauled in, like an animal that big, get like essentially hauled in with a crane is how we usually will like place them on a surgical table upside down with their feet hanging them essentially by their feet and using a crane to like lift them onto a surgical table and just being able to be a part of a case like that and watch a surgery trying to manipulate an animal that is that size was awesome.
Were you here or were you in Africa with this?
No, I was actually here in Southern California at an equine facility. And so I did get to watch a lot of other equine surgeries, and that was amazing as well. But we also had a zebra come in.
Wow.
Yeah.
And what surgery did they do on the zebra?
It was a wound repair essentially for its hoof.
You're like, it's routine.
Yeah.
Like, whatever.
Just a normal.
Just a hoof rule.
Yeah, it's normal.
On a zebra that's hanging backwards on a surgical table.
Yeah, that's kind of like how my daily life is. Yeah.
On a Tuesday.
Yeah.
And you just opened your own practice?
I did.
How long ago?
A year ago last week, actually, we celebrated our 1-year anniversary.
Congratulations.
Thank you so much.
So were you like sick of working for people and you're like, I'm doing this myself?
100%.
Yeah.
No, I had always wanted to open my own practice as well. But yes, it is truly a new liberating feeling to be able to work for yourself.
Yeah, right? You get to
100%.
like, come and go as you please.
Make all the decisions.
Right. When you opened your practice and now you're like truly like, oh my gosh, it's just me.
Yeah.
What was the first case where you were like, am I ready for this? Or were you just like, nope, I'm ready. I'm good.
I was ready, but because I knew that I needed to be practicing a certain amount of years, essentially, before I could feel like, am I ready to do this by myself without having any help? And that is different for everyone. It's not that like everyone's going to be ready at the 5-10 year mark, but I had been practicing for 6 years prior to being like, okay, I'm ready to start looking into opening my own practice. And so at that point, I was already comfortable being like, yeah, I'm okay if I'm by myself. I was doing relief work where I was filling in like as a locum essentially to other clinics while I was trying to start my own clinic. That, I think, made a huge difference. So then day one, I was like, yeah, I can do this. And if I need help, I can call a colleague and ask their opinion on something. But I truly did feel ready to just be doing it all by myself.
And what kind of animals do you take care of in your practice?
Anything that can fit through the door. So, so hamsters, geckos, birds, snakes, dogs, cats, goats, llamas, alpacas, anything.
I know where your practice is because it's down the street from my house. So you're telling me that like people have brought goats through the door?
Yeah, absolutely. Some people still in Orange County have goats and have more land, a little bit of land. And I also get clients that come from like all over. So LA to San Diego.
I mean, I hesitate to use the word crazy. What's the craziest animal you ever operated on in your practice?
I don't know if it's so crazy, but miniature pig.
And what'd you do?
That was fun. I spayed her.
You spayed the miniature pig?
I spayed the miniature pig, yeah.
Did you
So
put
that
the
was
cone
fun.
on the pig?
No, luckily they can't really reach their incision because of their anatomy.
I was a third-year medical student. I don't have any money. I'm in med school. The only money I have, I get from my mom, right?
Mhm.
It's third-year medical school. My father-in-law bought us my blue heeler.
Yeah.
Okay? We got a spade, and the suture's there. And I was like, hey, bro, I mean, do you put the cone on the thing? He's like, oh, no, she doesn't need a cone, right? It's no big deal.
I'm sure she ripped her suture right out.
Ripped her suture out. I'm
Mhm.
in the hospital, and my wife is calling me like, Alice ripped her suture out. Her insides are coming out. What do I do? I don't know what to do. And I was like, all right. I'm going to leave. I'm going to get my buddy to cover me. I'll come home. So I go home and I have sutures and all the stuff at home. And I could do this. Like, whatever. It's just putting a suture in. I was like, hey, babe, I need you to hold her down. She looked at me and she was like, fuck no. Like, I'm not holding down anything. So we take her to the vet. I had never spent more than like $1,000 in my life on anything.
Mhm.
We take her to the vet, and the vet says that she nicked her spleen. The vet had to take out her spleen.
Oh, no.
And then do the suturing.
Oh,
And it ended up being like $7,000 or something for a dog that cost $100.
Yeah.
How in the hell did Alice, my puppy, reach her spleen through this suture? That's like BS.
No, she probably opened her abdominal wall. Like,
She definitely.
I mean,
Like, you could see her momentum.
Yeah.
Momentum definitely all out.
then, yeah, I mean, even if she had just like laid there, rubbed, that the top of the incision is right where the spleen is.
All right, fine. All these years, I thought
You're like, that was BSing.
I was like, get out of here. I like looked up anatomy. I was like, the spleen's like sitting way up. You know, I was like, what are we talking about here? Anyway, all right, fine. I'm not mad at you anymore. It's official. So you are forgiven. Now it's time for What's the Buzz, presented by BuzzRx. Every week, I answer a health-related question from one of our viewers. This week's question: Dr. Rutland, I was recently prescribed benzonatate for my cough. Does it actually treat the cough, or does it make me not feel it anymore? This is a great question. The way the medicine actually works is it tells your body not to cough. You don't sense the cough. Because it inhibits voltage-gated channels within the nerve, it tells your nerve to calm down. And cough is essentially a reflex that basically gets fired when the nerve tells your brain to cough. It inhibits that signal into the brainstem. So when you swallow that medication, it tells that brainstem signal of cough to calm down. If you do cough, we still want to know why you cough. That's the buzz. If you have a question, email us at healthexchangepodcast@gmail.com. Thanks again to BuzzRx. Look up your medications on buzzrx.com or the app to see how much you can save. So since we're talking about dogs, I want to go off leash for a minute.
Okay.
All right, we're going to call this off leash.
Off leash.
All right.
Yeah.
What animal do you most identify with?
A Eurasian eagle owl.
Hold. A what? A Eurasian eagle owl.
Yeah.
Why?
Because they're beautiful and they're really powerful, but quiet and stealthy. They like woodlands area. I don't know.
A Eurasian eagle owl.
Yeah. Yeah.
Out of all the animals, I did not expect that one. That is amazing.
Good. I'm glad.
What's the first pet you ever had?
A dog.
You didn't have a hamster?
No. That was like the 10th pet I ever had. A dog and a goldfish were my first pets.
A dog and a goldfish.
Yep.
Nice. Most surprising animal you've ever treated in general?
A binturong.
I don't even know what the hell that is.
I know. You have to look it up.
What's a binturong?
A binturong
Is it a mammal?
It is.
Okay.
It's a South American carnivore. They're also known as a bear cat. So they kind of look like in between a bear and a cat.
A binturong.
Yeah.
What'd you do?
I spayed her.
You spayed her?
I did. Yeah.
Who has a pet binturong?
This was not a pet, actually. This was the binturong that's at the Santa Ana Zoo.
Yeah.
Because I used to work there as well.
They didn't want to make any more binturongs?
No, she was getting older and we were concerned that maybe she would get reproductive cancer or infection. And so we spayed her. We generally will routinely spay animals in zoos as well, unless they're part of a breeding program.
You said we were worried about her getting a reproductive cancer.
Mm-hmm.
So, like, you actually are thinking about that.
Number one reason that we recommend spaying and neutering your pets is reproductive cancers.
Do you replace hormones?
We don't, actually.
In animals, you don't?
We don't.
What about the animals that have the longer lifespans, like horses or something?
We don't spay them, luckily.
Oh, we don't spay horses?
No, we don't spay horses. We
Why not?
pretty much routinely just do it in dogs and cats and then some other small mammal species.
And bear cats or
And it is, like we were talking about earlier with the zebra, just a major, major undertaking of a surgery.
If you weren't a vet, what would you be doing?
I would be an artist, like a painter of some kind.
Can you draw? Can you
I
paint?
can. Yeah, I can.
Wow.
Yeah.
So do you do it?
I do in like my free time. I have like paintings of my pets at home and things like that I've
Do
done.
you really?
Yeah.
That's awesome.
Yeah, thanks.
How many pets do you have at home?
Currently, I have just 3, a rabbit, a frog, and a bird.
Again, I would have said a dog and a cat and a hamster.
Yeah.
You have a rabbit, a frog,
Yep.
and a bird.
And a bird.
What kind of bird?
I have a cockatiel, and he is 27 years old. I've had him since I was a child.
And you don't get short of breath or anything around him?
No, why?
Cockatiels notoriously can cause a condition called hypersensitivity pneumonitis.
Oh.
The antigen that they spread when you
I
take a
love
big
that.
breath in,
Mhm.
like it can cause an overreaction of your airway epithelial cells that
Yeah.
leads to the recruitment of white blood cells into your lung, your alveoli.
Look at you. You're
Get short of breath.
a cockatiel expert
Well,
now.
Yes. Yes. Yeah, that's funny. So the bird's been around 27 years.
27
How about the frog?
Frog's been around a couple of years.
And then what was it? A bird
A rabbit.
and a rat.
That's my last one. And that was a rabbit that I was fostering through a shelter. He was a foster fail, so meaning I adopted him.
Do you keep it in the cage or you let it roam the house?
No,
in the
he's
backyard?
free roam. Not in the backyard or anything. He's free roam in the house, though, just like a
Wait.
dog would be.
Really?
Yeah.
He's just like, so you'll come home, he'd be on the couch.
Not on the couch per se, but he is free roam when we're home. And when we're not home, he has like a room to himself.
Hold on, the rabbit has its own room.
Yes. He does have his own couch. It's very cute. It's like kind of the same color as your chair. It's like a miniature
What's his
one.
name?
Ralphie.
Ralphie.
Yeah.
All right. So if you were to pick one,
Yeah.
surgery or diagnostic?
Surgery.
No question.
No question.
How many surgeries are you doing today?
Depends on the day, but anywhere from 2 to 10.
And you have your own OR in the practice?
Yeah.
Cutest animal you've ever seen up close?
Honestly, a baby opossum. They're really cute.
It's an opossum?
Opossum.
Is that different than a possum?
Possum is just a slang term for opossum. But opossum is the correct name of the
There
animal.
you go. You heard it here first. I didn't know. Wow. What's the one animal that you're secretly afraid of?
Tarantulas. I do treat tarantulas. I secretly don't love them, and I feel bad saying that.
What do you treat them for?
The last tarantula I treated was limping.
So did you put like a cast on a tarantula? Or
No, I just said wait till it shed, since they shed their exoskeletons and, and then it stopped limping.
So the tarantula comes in, you're like, wait till it sheds. Come back if it's still a problem.
Pretty much. I mean, we can give them some medications, but it was minor. So I just said, let's feed it so it sheds quicker, and then it stopped.
So this lady who has treated a lion as her first ever case walked in a cage with a lion, like, no big deal. Let me just give you some diazepam, but could you just hold the neck? Is scared of a spider. What's your favorite weird animal fact?
Okay, well, it goes back to the binturong, but they smell like buttered popcorn. They release this. They have a specific odor.
So
buttered
after
popcorn.
you treat a binturong, you want to go to the movies?
Pretty much.
Is that the deal?
Yeah, 100%.
What's your favorite vet-related movie or TV show?
Dr. Dolittle. I mean, we all want to be able to talk to them, so I honestly don't know if I know any other vet-related movie or TV show.
What's harder to deal with? And this is a doozy of a question.
Okay.
The animal or the pet owner?
The pet owner. Again, working in an open concept practice like mine, where the owner gets to be with their pet the whole time. Even if they want to watch surgery, they can. But it is totally different. You're dealing with an animal that can't speak and a person that's afraid because their animal is sick. So it's much harder to navigate that part.
When you're operating, this is going to be maybe a tough question.
Yeah.
Have you ever lost an animal while you're operating?
Knock on wood, I have not.
Wow.
I have in recovery.
You're like, oh my gosh, what happened?
Yeah, unfortunately.
It had nothing to do with the operation, you think? You think it was just...
It's tough because some of the cases are like really significant ischemic injuries or really severe underlying diseases that are going on with these animals. But if we don't do something, they're not going to make it. Yeah. So it's like a lot of times we go into it knowing that we may not be successful, but it's still really hard to go into it knowing that.
If animals could talk, what species would be the sassiest?
Cats. Cats for sure. Dogs have owners. Cats have staff. That's what most people say.
Oh my God. I have never heard that.
Cats for sure.
Cats for sure?
Yeah.
Oh my God.
They would be the sassiest.
One tool or drug you wish people knew animals used to?
Honestly, like every medication that people use, animals use too.
I give my dog Prozac to calm it down,
Yeah.
actually.
But I feel like that's like a good one that a lot of people can understand.
It's the most misunderstood animal condition.
Cushing's disease.
You want to tell us what Cushing's disease is?
Cushing's disease, or hyperadrenocorticism, is what we call it. Essentially, when the body is making too much cortisol, it can cause so many problems for people and animals, right? There's so many different aspects to control. I do think it's just very misunderstood in a way that it's so hard to really treat.
What's a moment in your job where you were just like, I'm so proud of myself. Like, I really did that well.
So I had a hamster come in with a broken leg. The owner, it's a good client of mine, she accidentally dropped a spoon on the hamster. On the hamster. She was sitting down with the hamster eating, dropped the spoon. The spoon unfortunately landed right in the right spot on the hamster's tibia, broke, clean break. And I was like, okay. She called me right away, got the hamster in, and I pinned the leg, an IM pin with a 24 gauge IV catheter stylet was my IM pin, because that's the smallest thing I had. And great. Hamster healed great. That was many years ago, so the hamster's not alive anymore. But it was awesome. I will say.
You said this lady was like a continued client of yours.
Oh, yeah.
You saw this lady all the time.
All the time.
For her hamster?
Oh, she's a breeder, so for many hamsters. But she's an ethical hamster breeder.
What's an unethical hamster breeder?
Most of the ones that you can buy from PetSmart, unfortunately, because they're just being bred like crazy just to be able to be sold, but they don't have the best genetics. So she's really trying to change that about the industry and breed hamsters that don't have any problems. A lot of the hamsters in the pet stores have these like really cute little smushy faces, kind of similar to like a French bulldog,
Yeah.
but that's not really the healthiest. They have a lot of underlying conditions, just like a
So if
French
your hamster
bulldog,
looks like a French bulldog, you got gypped.
probably.
Is there anything that you're just fascinated with where you've seen like, oh yeah, this is animals and now they're talking about it in humans?
One thing I can say that I've always found fascinating, but also it's because one of my professors in vet school was like the person to discover this. But because I work with a lot of birds, we do have the concern for West Nile virus. My professor was the person that discovered it,
Your
essentially.
professor discovered what?
Yeah,
Virus?
Tracy McNamara worked at the Bronx Zoo, and there were all these animals getting sick and birds dying, and then people were getting sick. And she's like, "What's going on?" And she discovered it. And that has just always stuck with me because now there's still a concern for, oh, do we have an outbreak of West Nile, or the more we see like certain birds or wildlife that come in that are not doing well. And I do find that very fascinating that we see a lot of on the animal side of things.
And we call that, zoonotic infections, right? So
Yep.
there's a lot of different viruses that are discovered in animals. And because viruses can mutate or because we're taking care of animals, slaughtering animals, whatever, humans can contract some of these viruses, right? And so rabies,
Yep.
there's a lot of mosquito-borne illnesses in livestock that those mosquitoes can end up infecting human beings. And so there's a whole organization that is based on studying this and making sure that all these protocols are kept up. And that's that One Health organization, right? What do you know about One Health?
It's imperative, honestly. I think in healthcare in general, and especially in veterinary medicine, because part of my job is to protect the animal, but also people. Because so many of these things, like you said, zoonotic, can potentially come from animals. There are a lot of things actually that animals are getting that can come from people that we don't really think of, like, oh, they probably got it from the pet owner. And so just having to know that and educating about that. I worked with 400 birds recently, parrots that were confiscated from like a hoarding situation, and they all were really sick. And so I had to be really careful to make sure that I didn't get sick because there are a lot of zoonotic things that we can transfer. And I did end up getting sick shortly after that. And when I went to like urgent care, for example, I was like, hey, I've been exposed to XYZ diseases, and they didn't know anything.
They have no idea.
No clue. So I was like, okay, no problem. Can you please test me for these things? And can you please prescribe me this medication? They're like, sure.
Yeah.
We experience that on a daily basis, honestly. But that's part of the One Health. Like, it's really important to be able to educate others on the things that we're seeing.
It's very important because when you look at antibiotic resistance, when you look at zoonotic infections, when you look at how food is handled, potential food is like all of these things are important. Avian influenza, even like again, you have all of these conditions that can affect the human population. SARS-CoV-2, we say came from, SARS-CoV-1 definitely came from bats. SARS-CoV-2 likely evolved from there. Who knows? But again, understanding that is very, very important, right? Rabies, Ebola, so many different examples of zoonotic type of infections that can lead to human disaster. Organizations like that are absolutely necessary. When you go into a scenario where you have animals that are sick, a group of them, how do you protect yourself? Do you use PPE? Or
PPE.
just like completely.
Yeah, complete PPE. We have isolation areas to where we can keep those animals so they're not infecting anyone else or any other animals in the hospitals as well.
Got it. When do you take that extra step to really use your
Yeah.
PPE?
I would say mostly for any of the cases or any of the owners that call and say, hey, my pet is having respiratory signs. That's when we are using PPE almost every time. No, not if they're having just vomiting or diarrhea or something like that. But respiratory signs, 100% of the time, we're pretty much using PPE and keeping them in an isolated area no matter what their age is until we can get an initial assessment, because then we also don't want it to be highly contagious to other animals. So even if it's just one animal that's like that. Otherwise, if it's multiple animals in a household that are sick, then I'll treat it a little bit differently or use extra caution with some of those cases.
What's your favorite? I know you like surgery, but what's your
Yeah.
favorite thing to take care of?
I don't know if I can say just one, honestly. Like, I feel like that's why I do what I do and see so many different types of animals, because I have always loved to be able to take care of all different types of animals. And if I just did one, I'd be really bored. Maybe I could say one thing that I absolutely love, going back to surgery, is just being able to routinely do spays and neuters for any type of animal. I had been previously trained in high volume spay neuter, meaning I can spay a cat in 5 minutes.
What?
Yeah. Yes.
Okay.
So that's something that it's fun. I love to do it, and I do it all the time. So it's just like, if anything, that.
Wow. Okay.
Yeah.
When we look at biomedical breakthroughs, right, and there have been plenty of biomedical breakthroughs, are there any animals that come to mind when you think of biomedical breakthroughs?
Pigs. Definitely pigs.
Yeah.
For sure.
Because of the cystic fibrosis pig, or because of like what biomedical breakthrough are you thinking of with pigs?
Cystic fibrosis, heart disease, transplants in general, trying to see if a transplant can be successful and they can be maintained in a pig to then see if that can be replicated in humans as well.
Have you ever taken care of a friend's pet, like a friend that you've known for a long time?
I have.
Yeah.
Yeah,
Have they been seriously ill?
they have. I've even had to put down their pets.
How did you feel when you had to put down your friend's pet? Was it special for you? Or was it, I can't believe I'm doing this? Like, what was it?
Yeah. I mean, heartbreaking, of course, because I also had like a special bond to that animal as well
Yeah.
as they did. But also like this sense of honor that my friend trusts me that much to care for their pet in their final moments. Just like huge sense of gratitude that I'm able to provide that for them and the pet.
Is there a story where you're really connected to an animal and an owner
Mm-hmm.
in which, not like the hamster story of the broken leg,
Yeah.
but a story where this pet was really sick and you just hit on all the right things and now that pet is doing great?
I can think of one recently of a guinea pig that had dental issues. So guinea pigs' teeth are continuously growing. They don't ever stop growing. And so if they're not eating an appropriate diet, they may overgrow and then start growing into the cheek or the tongue or the outside of the mouth and curl around and things like that. And so this owner is very intuitive, knowing like, I think there's something wrong with my guinea pig, like a dental issue. And right away we were able to find the dental issue, fix that. And the pet, it still had a bit of a recovery, but went back
What
to
was the dental issue? Was it an overgrown tooth? You shaved it down?
multiple teeth. So all of its cheek teeth, which are essentially premolars and molars, were overgrown, and they were pointing and like touching each other and trapping this animal's tongue, so he like physically couldn't eat. So
How'd you treat it?
shaved down all the teeth. Yep, did essentially like a float is what we call it.
Yeah.
And trimmed all the teeth. His incisors were also overgrown, so trimmed those, put him on a critical care, kind of like a liquid diet for a period of time. He went back to eating. It's just this really like gratifying thing to be able to find something that can cause the guinea pig to completely decline, pass away, obviously, if it's not being able to eat. And something that was able to be fixable, that the owner got to watch me do as well and record and just be part of, and then watching that guinea pig go back to eating.
Just some kind of practical advice questions like
Yeah.
I have for you.
Yeah.
You're a kid in the neighborhood, you get bit by a dog that you don't know. What are you supposed to do?
Call animal control, because we're going to want to know the status of that animal. Has it been vaccinated? Do we know anything about it? If we don't know anything about it, or it's never been rabies vaccinated, then it's going to be super important to go get a rabies vaccine.
You have a cat at home and your cat scratches you.
Yeah.
And you're bleeding.
Yeah.
Don't worry about it because it's your cat, or
still go to the doctor so you can get that cleaned up. That's the biggest thing. Cats, even their nails, have a lot of bacteria just from the environment. And if they scratch you, and most of the time they're pretty deep and pretty painful, you really need to get that cleaned up. You might not need an antibiotic for it, but you need at least a good deep cleaning of that scratch.
You have an exotic animal. Say you have a snake,
Mm-hmm.
and you're playing with your snake, and it bites you,
Mm-hmm.
pierces your skin.
Yeah. If that happens, I would still say the same thing.
Yeah.
Go to the doctor, get it cleaned up.
What if you have a venomous snake as a pet? What are you supposed to do?
Call an ambulance.
Call an ambulance.
Yeah,
Okay.
100%.
People that have normal household pets, dog, cat, I guess hamster, bird, like what kinds of things do you want people to know about having those pets?
The biggest thing that I treat is husbandry related issues, especially when it comes to like exotic pets, for example.
Husbandry?
Husbandry related issues.
Okay. All right.
Which means just the general care of the animal, like diet, their enclosure, all of that. Those are the biggest problems that I see. Basically, people not knowing how to care for their pet because they don't know like its normal diet or what it should be on. And that happens with dogs and cats too. My biggest thing is find a veterinarian that you love that can treat any pet that you have, that you can go in for preventative care. It's so important because just like with people, you would probably tell your patients to go to your primary care physician for just routine care yearly. And that is what we should be doing for our pets at minimum as well.
What is something that you wish you learned in veterinary school that you encounter now on a daily basis? You're like, man, we should have talked about this more in vet school.
Mental health. Definitely mental health. I think we touched on it, but just the toll that the job takes on you, the emotion when you've done your 5th euthanasia for the day, and you have to go home and process those emotions. Just learning how to do that. I wish we did in vet school.
It's a tough one.
Yeah.
It's hard on humans, hard on your pets.
100%.
Anything else that you want to say to everybody out there?
Veterinarians care so much about your pets. We truly do treat them like they're our own. And many of us in the industry are trying to break those barriers of access to care, finances, being able to really show pet owners and the public what we do. So we're definitely there for you and your pets.
Where can we find you, Dr. Pokard?
Yeah, you can find me at Dr. Sydney _DVM on all social media platforms. And you can find me at my practice, Fauna Veterinary Collective in Foothill Ranch,
which is down the street from my house. And so we will be taking our hamster and our 2 dogs to your practice.
I'm excited.
You're getting more patients. And let me tell you, my 2 dogs are interesting characters.
I can't wait to meet them.
Thanks for watching and listening, you guys. We're on Instagram at the Health Exchange Podcast. Get us everywhere you get your podcasts. We're on Apple Podcasts, Spotify, iHeart. This was a great discussion. I learned a lot. I'm sure that you will see me on social media at her practice with my 10-year-old daughter who wants to be a vet. Thanks for watching.